Hello, and welcome to another exciting edition of SYNLAB podcast. My name is Uchenna Amadi, and I'm your host, your guide, and today, your friendly reminder that talking about sexual health is not a taboo. I mean, if we can talk about jollof rice, how much more your sexual health? Well, today's topic is your sexual health, your power. And to do justice to this conversation, I have two amazing guests, brilliant minds who understand the science and the human side of this topic. Before we dive in, do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify so that you don't miss an episode. Now, let's introduce our guests. And because it is ladies first, I'm going to start with Mrs. Unyime Etura. It says there that Mrs. Unyime Etura is the Regional Operations Manager, Lagos and West at SYNLAB Nigeria, an exceptional leader in operational efficiency and team management. She oversees more than 100 team members across 20 locations. I'm coming for SOP because 100, that's a lot. Wow. And which basically means she manages more people than some small villages. Yeah. With 16 years of post-NYSC experience, she has mastered process improvement, excellence in customer service, and operational efficiency. She holds an MBA in global business from Nexford University and a bachelor's degree in medical laboratory science from the University of Calabar. Mrs. Unyime, is a delight to have you here.
Thank you.
How has it been managing 100 people?
Well, it's been fun. Different personalities, different attitudes.
Yeah.
We somehow have a way to get a hang of it.
Wow.
And everyone ends up being happy.
Nice. Once again, it's good to have you here today.
Thank you.
We also have with us Dr. Emeka Igbodike. It says here that Dr. Igbodike is an award-winning obstetrician, gynaecologist, minimal access surgeon, editor, and business consultant in sustainability. A graduate of Nnamdi Azikiwe University, Oka. He is also an award-winning fellow of the West African College of Surgeons and the Medical Postgraduate College of Nigeria, both obtained at the Obafemi Awolowo University Teaching Hospitals Complex, Ile-Ife. He has authored more than 55 scientific papers. Wow. Published in reputable local and international journals and has presented at numerous scientific conferences worldwide. He serves as the second editor of the Punchline Obstetrics and Gynecology textbook, authored by 80 teachers, and is a chapter contributor to a textbook on systematic reviews and meta-analysis. I want to adjust first before I proceed. So I'm looking at this thing I'm just reading now. Wow, in person. That's quite impressive. Wow. Dr. Igbodike is also a newspaper columnist and a peer reviewer and editor for several scientific journals. He holds an MBA in sustainability and development, covering agribusiness, healthcare, and green energy from Nexford University.
That's my career.
Wow, USA.
Yeah.
Wow.
Yeah.
It is a pleasure to have you here, sir.
Thank you so much.
When they say Idon is outside, he's one of them. The EQMS. Yes. Not them. Wow.
Thank you.
Wow, this is actually impressive. 55 scientific papers.
Wow.
Not challenging at all.
No. So we love research. Yeah, we believe that medicine without research is quite boring.
Yeah.
You must
Exactly.
answer questions.
Yeah, drops mic.
Continue to answer questions.
Wow,
Yeah.
this is quite impressive. Really lovely to have you here.
Thank you.
Once again, our listeners, do not forget to subscribe, like, share, and comment on this episode. Share this episode that we're about to dive into anybody that you know needs it. So before we begin, let's remember that our sexual health is not just health. It's confidence, freedom, and clarity. It is also peace of mind wrapped up in one. So before we dive in, I would like us to actually pay attention because some of us don't like talking about this Like I said earlier, people think it's a taboo. It's actually not a taboo. Knowledge is power. So have an open mind as we dive into the first question. Now, I'm going to be asking Dr. Igbodike, why should sexual health be seen as part of overall health and well-being?
Yeah, thank you very much for that.
I like how you started by clearing your throat.
Yeah, so sexual health is one very important component of reproductive health, which we sincerely need to talk about. But it's also very good for us to clear the air, because if you are discussing anything, it's important to have a definition of what they are talking about. So, World Health Organization 2006 have this definition of sexual health as a state of physical, emotional, mental, and social well-being in matters related to sexuality that is not mere the absence of deformity or infirmity or disease.
Yeah.
So this is the definition. So with this definition, it tells you that anytime we talk about sexuality, it's also for us to, because these are all key words. What's sexuality, So sexuality per se has to do with not just sex, because sometimes that is what we summarize it to be. It has to do with values. It has to do with perception. What is, how you relate with others and all that. So by the time we put all these things together, you will discover that we sincerely need to have a very good sexual health for us to even relate with our spouses, relate with people, relate with our environment, and of course, legally. So that is essentially what we need to talk about today. And of course, as we expand it, we discover that there are also issues that also influence sexual health, sexuality, and by extension, sexual health.
Yeah.
Like, for instance, people's religion, people's culture, and all that. So by the time you have all these things in a summary, that will give you the reason why we should take sexual health very seriously.
Thank you very much. I like when you said clearing the air, because we want to go into the myth and taboos around sexual health, especially in Nigeria. Okay. So what can you say about that?
Well, usually the normal thing is that people don't even have sex normally in the world.
I don't understand what you mean.
How
are we starting like this?
Yeah, exactly. So, because our culture, exactly, you mentioned Nigeria. Why I say so is that people don't have sex until they are pregnant. So when you see pregnancy, of course, you have to do retrospectively, know that they've had sex. Otherwise, nobody ever have sex. That is the pattern. And this is not very good because, first of all, you mentioned the word taboo. So in most climes, especially in Africa and of course Nigeria, which is an extension of that, is that people should not even mention sex. You shouldn't be talking about sex, openly.
Yeah.
All right. And this is the major issue. Because people don't talk about it, the issue that bedevils it is now not being discussed. Which is why this particular program is excellent, So, the taboos, for instance, somebody can tell you that, that you might need to use 2 condoms to have sex and all that. And you'll be wondering, where did this person pick this from? Exactly. Because there is no information. Somebody enters a pharmacy and he wants to pick up a condom. You say, please, do you have a plate? Because there are people around. So where people
disagree. So let me show you. The person in the supermarket will be like, you want to buy condom? Come to the front. Come to the front. Oh my God.
Exactly. So you see, so these are the issues, So so it's important we look at this. So we mentioned the issue of taboo. So first of all is the issue of even discussing it. That's a problem.
Yeah.
People don't want to say that, And even when you say it, they are wondering, maybe this person is the worst sinner. I remember what I said initially, that even spirituality, even religion, that they have to modify the way we perceive our sexual health. And I feel that is what this discussion is all about.
Wow. This is getting interesting.
Yeah, really.
Okay. So you said okay, now our eyes are gradually being opened that it is not actually a taboo. So how does taking charge of your sexual health give you confidence and peace of mind?
Okay, so now when we talk about the issue of taking charge, first of all is an individual understanding what sexual health is all about and the component. Remember, I mentioned the physical, mentioned the emotional, I mentioned the social, and of course, the when you look at all these components, an individual might not be able to have a sound sexual health if the person is emotionally drained. All right. We'll give an example. Here is a couple, that maybe the husband beats the wife. All right. What we call intimate partner violence. So at that point, there's already a problem with the way of relationship. Remember, I said that sexuality is not necessarily about having sex, it's about how they relate. So if there's already a problem with that relationship, how do you now, talk about the issue of even having the intimacy, which is supposed to be part of the sexual, health? So now, again, you have a woman who is having, let's say, pain during sex, what we call dyspareunia. All right, we have the superficial, which is during insertion, then the deep during the sexual intercourse itself. How will this individual have that particular mindset that is really enjoying the sexual health? No, there's already a problem. All right. So these are the issues you have to look into. All right. And of course, the issue of the STIs, which is all over the place. But these things are not even mentioned. We talk about the issue of syphilis, the issue of chlamydia, the issue of gonorrhea infections, and HIV, hepatitis, and so on. So how will an individual, like for instance, we know that most of the symptoms are not even, they are asymptomatic. They don't show anything. All right. So this individual keeps on moving from one person to the other without necessarily knowing that there's a problem.
And sharing it.
Yes. So a guy is meeting another lady. You are not aware there's a problem with trust issues because you don't even know what we are talking about, the issue of taking charge, right? Of our sexual. So you don't even know what is the how clean, let me use that word in parentheses, that partner is.
Yeah.
And before you know it, they engage in a sexual intercourse. Then from there, if there is a mixture, give me, I take,
Exchange.
take and give, exchange of information, or of course, at this point, disease.
All kinds of information.
At this point, disease. Then from there, they pick it, and this person is not even faithful. We talk about the issue of ABCs, abstinence, be faithful. Then he shares it to another person, another person shares another person.
shares. The
so-
networking.
the networking. You understand?
MMM.
So how can these individuals have, be in charge? They can't be in charge because they don't even know their status. We talk about the issue of screening, a field of education. They don't read books. They don't know what's the latest is being said about. So there's a problem.
Yeah.
But usually taking charge has to do with, first of all, is knowing the person, the self. We talk about issue of screenings, all right? People should learn how to do basic screening and go for them. We'll give an example of cervical cancer screening, okay? Now, sexual health, you might say, how is the relationship between cervical cancer and sexual health? HPV, human papillomavirus, is one of the key DNA viruses that causes about up to 97.4% of cervical cancer.
Wow.
Yes. And these particular viruses can be transmitted sexually.
Yeah.
Now, let me now shock you. Male condoms alone
Does
not prevent
Exactly.
against HPV. Because some people, once you put on male condom, they said,
They
that's
feel
it.
safe.
You feel safe. Because labioscrotal contact is enough for the transmission. You understand? So, how would the individual know that he or she, it's more of females again, so don't say I'm being, but
Yeah, always biased, but there's no problem.
the screening, the more of, so, but by the time they do the screening, they will know that they have HPV, or at least they see the cervical changes, then the individual will take steps. So when there is no screening, how do you know? And at the end of the day, this individual is not safe, does not feel good, and you have all the disease. So the knowing the status
status.
is very, very important by screening. Now, for the ages like 25 and above, which is classified at the high-risk group, it's also important that they screen for chlamydia infections. Yes, because chlamydia is one terrible sexually transmitted infection that does not necessarily showcase itself.
Symptoms, yeah.
Most of them don't
symptomatic,
even
yeah.
show.
Yes.
That's the scary
And
part.
yes, and that is the problem. Gonorrhea may show you one or two, maybe vaginal discharges, then syphilis might have rash. The person might be rubbing, so let
What
me stop
about
at...
herpes simplex?
Yeah, sure. Herpes simplex again comes with, there is something that looks like pimple. Over time, it's bursts, it crusts, it causes pain, and it comes back again, but they don't check. They don't even know what's going on.
They might just think it's a boil. I just had a boil.
A boil, absolutely.
And people who have, this is the herpes simplex. We have the herpes simplex 1, herpes simplex 2.
Yeah.
The one has to do with the oral thrush thing.
Yes.
And, growing up, people used to mistake the oral thing. They'll say, oh, I'm having fever, fever blisters, fever, malaria blisters. And meanwhile, it's herpes.
Not malaria.
It's not malaria,
Wow.
Then the herpes simplex 2 is the one that affects the genitals. But there are times I have this question, doctor, that, someone is like, okay, is it possible to someone that maybe through oral sex transmit they'll ask, okay, can 1 become 2?
Okay.
You know how oral sex happens. Maybe the person has blisters and...
It's a possibility, because when we talk about oral sex, it had different shades. The cunnilingus and what have you.
Yeah.
People put in their genitals. So organisms from there can be transposed, from the genital to the mouth or from mouth to the genital. Vice versa.
Wow.
And of course, it's not just herpes simplex. Now, all that, sexually transmitted infections can be transmitted. So people should indeed be responsible about their sexual health and, know what they do.
Know their status, practice safe sex.
Yes, because for emphasis sake, I just wanted us to outline again. So, what simple steps can people take, to start owning their sexual health? I know he talked about the ABC and the rest of them. So, I will come to you briefly and then he will summarize.
Yeah. Okay. I think he's meant, just to continue from what he said, know your status, own your health. Go for screenings. For you to know your status, you have to go for screenings, the necessary checks. Then open communication with your partner. Discuss this thing. There's no need. It's not a taboo. There's no need. You have a partner, you have a husband or boyfriend, girlfriend.
If you're having it, your partner is having it as well.
Yes, exactly. Then practice safe sex.
Absolutely.
Practice safe sex.
Anything you want to chip in at this point?
In fact, when we talk about the issue of safe sex, some people think it is just one of those things. In fact, we have to go into a further step by even talking about safer sex.
So, what does that mean?
Yeah, so now we have a situation whereby when you use contraception to prevent pregnancy, then prevent sexually transmitted infection. So double Dutch, so 2 things. So the safe sex, we are preventing STIs. Safer, we are preventing pregnancy and also preventing, because some people, one of the, we'll call it myth, is that once people are taking some, in fact, I have heard, I've heard people that said that once they have sex, illicit sex, they just take augmentin. And that's it. It's good.
Wow.
I don't know where the person got that from. But yeah, that was it. That once you just take 2 tablets, it's good.
Wow.
So people misconstrue these things. And that will tell you that with that mindset, that individual goes in a rapid rampage of every indiscriminate because he believes that 2 tablets of antibiotics is going to just give him or her safety. Right. So these are real things. And so another thing we also talk about in issue of this is vaccination. Vaccination is also very important. And of course, there are a whole, lot we can vaccinate about the issue of the HPV. All right, we tell people about, you have the Severic, you have the Gardasil 9, and so on. People should, get into this program and get vaccinated. Because of time, let me stop here.
Because it has really been
Yeah.
a truly interesting and an eye-opening conversation. So to my listeners, do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Share this episode with your friends and your family. Stay tuned. We'll be right back with even more exciting episodes.